Do you or someone you love have neuropathy and you're on medication and it isn't working enough or even at all? If the meds that you are taking are not treating your symptoms of neuropathy, including sharp, excruciating, often debilitating pain, numbness, or even tingling in your feet, then pay close attention. Sierra Hale, a clinical educator at Comprehensive Integrated Care, she is here to help. So many people, they're watching and they do respond well to the doctor-prescribed medications, and some don't, or at least it may stop for them. What are some other options?
So basically, neuropathy symptoms can be very similar to poor circulation symptoms. So if you've been prescribed medication for neuropathy and it may have worked for a little while, it may not have worked at all, and you're still having the same symptoms, it could be caused by poor circulation. So that's where we're here to talk about coming into our clinic and getting that second opinion.
Right, and again, that second opinion for a lot of folks, it's life-changing.
Yes.
Because you can't do a whole lot if you're not feeling good. What can patients expect at that first appointment with the doctor?
So when they come into our clinic, they are going to meet with an actual doctor, which is huge. And the doctor is going to spend time with them, and they're going to talk about their symptoms, and they're going to come up with a treatment plan. And in our office, we are a multidisciplinary clinic, so we have several different doctors and specialists in our clinic to help come together and do a treatment plan for each specific patient.
All right, so I know the treatment that we're specifically talking about is that for poor circulation.
Right.
How does a person even know or figure out whether, yes, it is neuropathy or yes, it is poor circulation?
Right, so like I said, the symptoms are very similar. At the end of the segment, we do have a special offer for anyone who calls to get a free screening to see if the symptoms are caused by poor circulation. They are so similar to neuropathy, but the biggest thing is that if the medication you're using for neuropathy isn't working or has stopped working, this is where the symptoms could be caused by poor circulation, and it may not be neuropathy at all.
What are patients sharing with you about this treatment?
So this treatment is minimally invasive. Some people even say it's ultra minimally invasive. So basically what this treatment does is it restores blood flow back to the feet and the toes. So the numbness, the tingling, the excruciating pain subsides. Some people only need one treatment, some people need a few, and some patients are even having their symptoms go away after a few hours after the first treatment. Sometimes it may take a few days, but patients are extremely happy with this treatment.
I can imagine after living in pain for years and years. What about insurance or Medicare? Because a lot of people have to make a decision about treatment based on whether they can afford it.
So at our office, we do accept most insurances and Medicare, so these treatments most likely are covered under that.
And let's talk about who's a good candidate for this, because you talked about whether you don't really know for sure till you come in, but who should come in?
So if you or somebody you may know has been treated for neuropathy and they're on medication that isn't working for them, they're still having those debilitating issues and symptoms, this is where coming into our office and seeing if poor circulation is the problem would be a good idea.
Yeah, and again, you said the treatment, sometimes it's just one treatment.
Absolutely.
And it changes their lives.
Yes.
Here's a special offer. The first 20 callers will receive a free private screening with one of the doctors at CIC to see if you are a good candidate for treatment. Comprehensive Integrated Care, they have clinics valley-wide, plus in northern Arizona. Call 480-374-7354 or visit the website ciccenters.com to book an appointment.